All right. All right. Well, hello, everybody. My name is Scott Mullett. I have a background in athletic training from the University of Kent State University, where I received my bachelor's and also my master's degree. I've worked in the secondary school setting for 6 years and currently working in the industrial setting. I also own my own business called AT Efficiency, where I collect, analyze data, and do consulting work for sports medicine companies across the country. Today, I want to talk about the data-driven athletic trainer, where this is essentially my passion to help develop more clarity within our profession regarding what our value is and what we can do in hopes to become more organized as a profession when we're looking at documentation. And I want to link that information, the data that we collect, to opportunities for ATs across the country. So I'm going to be sharing my findings and keys to success. So I want to look at this as a living presentation where, as data changes and technology changes, this can be updated. But looking at what the course objectives will be for the presentation, first, I want to look at the idea of utilizing data science concepts in athletic training when documenting. Also want to look at data collection techniques and how to present to stakeholders. And we're going to have to stop because it doesn't look like it's moving. It's all right.
Well, and I just clicked that there. Yeah, so I could do it. I can do it real time. So I'm controlling it on my one to where I can do it. If I had a sense as I listen,
yeah, maybe we could just do that.
So, and I don't know. And if you're kind of ready and I haven't picked up on it, you could just kind of say next slide or on the next slide, and I'll listen and pick that up.
Okay,
so.
Yeah, that should work. I usually do that. When I'm presenting here, and usually someone's controlling it and they have no idea they usually get a sense of where I'm going with it. So
right.
I think we can do that. So why don't we restart again before we got into this, and we'll go from there.
Okay, I'll go ahead and restart the timer, and I'm restarting it right now.
All right.
You're on.
Well, hello, everybody. My name is Scott Mullett. I have a background in athletic training from Kent State University, where I received my bachelor's and also my master's degree. I've worked in the high school setting for over 6 years, and for the last 4 years have been in the industrial setting. And I also own my own business called AT Efficiency, where I collect and analyze data and consult with sports medicine companies across the country. So data has quickly became my passion, as I've seen the value associated with the information that we can collect and present to our stakeholders. So looking at this presentation, I'm going to be sharing my findings and keys to success. And I want to look at this as a living presentation. So first, starting off with, I'm going to look at utilizing data science concepts in athletic training and how that relates to us best in the big picture. Looking at the triple aim approach and data's role in healthcare and the evolving of this athletic healthcare, as we'll call it. Data collection techniques and how to present to stakeholders. So what are we going to do with our reports? How are we going to present our reports to be effective? And then how to become a data-driven athletic trainer. So looking at what we're doing with documenting data. So this is a weakness among ATs, but it's getting better. Okay. Essentially, we are not reimbursed for the good quality of documentation. And with that, there are perceptions and barriers associated with documentation as published in the Journal of Athletic Training in 2017. So Welsh-Bacon did a really great study on collecting sample data with athletic trainers in the secondary school setting and asking them what are their barriers and perceptions with their documentation. Big barriers are the uncertainty of what to document. So again, no standards on what we should be documenting. There are a few outlines, but a lot of it's going to be dependent on where your standard operating procedures are coming from and your organization. Time is going to be a big one, a limited facility and personal resources. So some perceptions that the athletic trainers in the study had were the lack of quality with their documentations, the expectations and accountability. Again, we're going back to the uncertainty factor, the priority, and the incentive. So when we look at incentive, other healthcare professionals are reimbursed for the documentation that they develop and input. But for athletic trainers, it's not so much the case. But in order to be that driving point of data-driven athletic trainer, we're going to need to document much better. And then also, finally, the secondary school culture is largely the result of poor documentation practices in athletic training. So moving forward with the time, so time requirements, according to the study, more time is spent providing coverage and less time for admin. So interviewing these athletic trainers and across the country looking at secondary school setting, yes, there is more priority spent on coverage. But in order to get the accurate information, we need to have that time spent for administrative duties as well. With that, there's lack of personnel and they're overwhelmed. So when we look at other professionals, we look at medical residents, and Cristino looked at a study that indicated 92% of medical residents believed admin requirements were excessive. So even in other professions, we're looking at the amount of time spent on documentation is taking away from patient interactions. So 91% indicate that documentation to compromise time with patients. So as athletic trainers, we are no stranger to that one-on-one interaction with our patients, and that's what is our driving force. But when we are essentially taken away from that one-on-one interaction and we need more time spent documenting, that becomes a gray area. But we do have other professions that have expressed the same circumstance. But as an example, as we move forward, looking at what a typical high school athletic training room. So I shared this meme online with pretty good reactions as people were indicating that this is accurate depiction of their facilities at the end of the day. So when we look at what to document, we have all these people coming in and we don't know what we should be documenting. We're overwhelmed with the amounts of work that's going on. And again, with the study, the expectations were uncertain what to document. Which patient care is important to document and we're more or less detailed than other professions. So documentation essentially is left to AT discretion. We have those that document, they have a lot of detail, others do not. But if we want to create more opportunities with the amount of data that we're collecting, we need to have the expectations that documentation is a high priority, right? So again, that's going to come down to time management and also, you know, how to document shorthand on notes and then looking into, you know, conveying those notes into electronics, medical records. But if you look at the scheme, we do have a lack of personnel. So looking at 67% of high schools only have one AT, according to WAM, and then based off of the prior study, ATs in 70% of high schools throughout the country, only 7% full-time, 31% full-time. So we understand that there is a lack of personnel associated with trying to get our documentation. And again, that is a weakness of what's happening. But as we move on and we progress in becoming more of a data-driven athletic trainer, we're going to need to take more time with the documentation. But as we look at some other studies that were conducted, when we're asked why, so essentially we have these barriers. We have these perceptions of documentation in athletic training. But for the most part, when we look at the Nottingham study for AT reasons and mechanics of documenting patient care in 2017, the consensus is that documenting our interactions with our patients are extremely important for communication, we're monitoring patient care, and legal implications, right? Other mechanics, we look at location, time of day, but the big thing here is we're again looking at the criteria. So the profession is understanding that we do need to do a better job, and that is happening. The NATA has released a position statement in 2016 that discussed proper documentation, and it's a really good guide. But first, let's focus on the communication aspect of documenting our patient encounters. Right? So according to the study, it identified documentation as an important component. So it communicates with patients, other clinicians, parents, coaching staff, what have you. And what we want to look at is we're also keeping track of our programs, so keeping everything organized. We're looking at the consistency and efficiency of the documentation. And a big thing with concussions, as we all know, there's a lot of working parts, there's a lot of medical professionals involved. So we need to be able to have that communication between many of those professionals, neurologists, primary care physicians, parents, coaches, what have you. And then the documentation is also going to provide education for parents in the secondary school setting, but for all of our patients. So what we're writing down, what we're finding within what we're documenting with this particular patient is going to be good education to convey back to them. But with that, all ATs are utilizing data to demonstrate value. And it's really a consistent way to market and brand yourself. We can look at the exercise program as if we're improving someone's care, right? So that's a really good indication of why documentation is important. So moving on to other areas within documenting, talked a little bit about the patient progress and updates. So when we look at it, nothing's more rewarding than when we can objectively see how our results are affecting our patients. And athletic trainers are unique to other medical professions where we see the before injury, during, and after. So we have a lot of opportunity to collect that information and put it into input it and organize it in an efficient way that we can connect with our patients with our guiding care. But when we look at the legal implications, You know, you look at other professions across the board and legal implications of malpractice, or there's nurses that are not documenting specific medications. They become big lawsuits, and there's a huge liability. So we need to put our standards to as other medical professions where there's a higher liability if we're not documenting the appropriate information. So when we look at other areas, including mechanics of documenting, the big area here is to look at the criteria for documenting. So ultimately, at this time, is the AT's professional responsibility. And we've talked about the legal implications, but, you know, even a bad lawyer will pick up on incomplete or inconsistent documentation. So it's going to be important to hold our standards high to input that information where we can protect ourselves. So looking at the other area of mechanics of documenting, looking at the discussion, so we can be used to characterize AT practice. So it is a system demonstrating the type of value. So are we just taping, or are we professionals that are providing thorough evaluations? Do we have detailed objective measurements? And that defines the value of our services that we're providing. So documenting is going to be big on demonstrating that value. But with that, we can discuss different outcomes that will come later. But within this study, so whole person health of documentation should include patient-reported outcomes. We'll look at outcomes a little bit later. However, these are rarely noted, it came up with. And then each incident range. So many develop different criteria. So the incident range in between how severe specific injuries were versus minor injuries. So do we document in our tracking giving a Band-Aid to someone? So obviously, yes, you know, we need to document who comes through our facilities so we are able to refer to those notes and to see whether or not, you know, something major or big might develop down the road. But really, the overall consensus is confusing. There's confusion regarding patient care documentation. But as we try to clear up the documentation practices and try to develop a better direction, we want to look at the demonstrating value aspect of it, right? So was there patient improvement? What are your cost savings and referral generation? So there's been really good information out there that not only do athletic trainers save communities money, but they also generate revenue in reference to referrals to hospital systems. So we need to document each patient encounter. So what types of services are provided? We're providing first aid with handing out Band-Aids. Are we looking at different ways in which we can focus on developing the cost savings for our patients? So as we look at the case coming up here, we're looking at what's happening with what I have experience with in the industrial setting. So there are two athletic trainers in the occupational setting, and what I do is I developed an algorithm to provide CPT cost comparison. So what's happening if the individual goes outside and not working with the athletic trainer? So how much costs are associated with that. So essentially, we're looking at how we're saving an organization money, and this works a little bit easier in the occupational setting. But just as a frame of reference, so when we're doing this, we're able to present this to our stakeholders, and in that time of last year, 2018, we were able to save the companies collectively $4.2 million in direct and indirect medical cost savings. Now, there's a little bit more to this, but we're able to present this, and within the last few months, there's been changes within directors, and we're able to convey our message, and we're able to increase our on-site not only time, but reduce any cuts and increase the worth of the company, which increases how much money we're getting paid, and so the salary of the athletic trainer goes up. So that's going to be extremely important for when we look at AT value. And just by looking at the different amounts of money we're saving a particular client. But we'll also want to look at athletic training services and daily patient encounters. So that brings us into that point, right? So when we look at that, so we want to be collecting different types of information. So are we taking into account that what we're taping, what we're wrapping in different stretches that we're providing? And there's a cost value associated with that versus if individuals went off site. So when we look at a total of 36,000, over 36,000 patient encounters, we look to solve that athletic trainers provide substantial preventative services for non-time loss injuries. So let's focus on the non-time loss injury. So looking at athletics, and again, that's what we were focusing on, we want to see that we are individuals that are able to reduce the amount of time loss for specific participation. And that's important because I want to focus on relating any type of athletic injury to really daily living, right? That will affect daily living. And if we compare this and we look at this as perhaps a work-related injury, then we can justify the value on having AT services on site within athletics and other areas. So with the encounter study and discussing this a little bit further, documentation is vital for demonstrating AT worth and value in terms of costs and services provided, right? So with that, there are other factors that we need to take a look at, right? So what are we doing and how are we combining all of this together in order to have these costs, in order to have this value of services? What are we looking at exactly? So breaking this down, there's a few different things that I personally like to focus on. So when we look at data science and data collecting, we want to look at types of data and outcomes important for athletic trainers. So one is going to be the clinical. So the goniometers, the manual muscle tests, the velometers, what have you. We want to measure what's happening clinically. So what is our strength at? What's our joint range of motion? How much swelling the individual has? So also functional. When we do a great job with that with our concussion baseline. So we look at what the individual was prior to the season with their concussion testing, and then with any type of impact or what other software you use, they sustain some sort of brain injury, take the test, you get the results, they go through the recovery, and then they go back to the testing again to see where you're at in regards to baseline measurements. And moving on to satisfaction, we want to see what that AT performance is. So it's going to be important. And if we're not having any type of satisfaction survey, we need to get on that, because it's going to be important to see where we're at, and that's going to increase our value as healthcare professionals. And then lastly, looking at costs. How much are we saving? How much are we generating? And talked a little bit about that. So we have the data points that we need to be collecting. So how are we going to utilize those data points into new approaches within the healthcare setting, right? So there are a few things that we can look at. And when we look at the triple aim approach to healthcare, we fit perfectly in this approach. And it's going to be beneficial for us as a profession to look at the data that we're using and to utilize it to our advantage. So what is the triple aim approach to healthcare? So we like to look at it as a triangle, of course, with three specific sides and dimensions, but are one collaborative outcome. And we're looking to improve the health of populations, so population health. We're looking to improve the patient experience, so better care, and then we're looking to reduce costs. So we've talked a little bit about all these together. So let's separate them and focus on specifics. So firstly, looking at population health, how are athletic trainers utilizing this and what are they doing? So when we look at population health, Shane Lee had a great study on the athletic trainers' effects on population health. And we're looking at improving the quality of care. So with that, we looked at quality improvement and how it can foster communication for problem solving. So that's the overall idea and what we're looking for. We're looking to foster communication and increase their problem solving. And we see athletic trainers as a central figure within this process. So that's why population health is extremely important for us to understand and to focus on as we progress as a medical profession. So we look at data and we look at the resources and what does data and experience tells us about what's going on. Well, they developed 4 separate projects looking at manual muscle strain rates, so comparative analysis. It looked at risk factors associated with successfully returning or the inability to return to a sport after initial injury, primarily focusing on ACL. Looking at AT-supervised prevention programs, and then evaluating the quality improvement. So before we go into these, we want to look at what is quality improvement, right? And how do athletic trainers utilize this? So Sowers had a really great study, another great study on quality improvement in athletic training. And what the steps in each stage looks at is, first off, everything revolves around the use of data. And then with that data, we need to focus on what information are we documenting. So we need complete and accurate documentation as discussed, and then we analyze the information. And then we go back and we look at the evidence and utilize evidence-based practice to assess gaps associated. So that's utilizing the quality improvement step, and as discussed before, that's why it's important to have thorough and complete documentation and hold ourselves at a higher standard. So again, now it's all fitting together. So moving forward to the specific study, and again, this comparative analysis with looking at muscle strain rates. So we're looking at how data helps. So from this, they looked at so any type of hamstring injuries, and they looked at per 100 athletes, and in the year 2014-15, there are about two hamstring pulls, muscle strains per 100 athletes. They implemented a program that focused on reducing hamstring pulls, and the next year they were under 1. So about 1. We'll say 1 hamstring strain per 100 athletes. So a reduction of 50%. So it's pretty good looking at a comparative analysis, and this is something that we can do on site within our organizations to help us achieve these data points, but also utilize our approach as having expressing value with the amount of data that we're collecting. So with that, another study associated with this main study was the risk factors associated with ACL tears. So essentially they had 60 athletes in this pool that had an ACL repair, and they looked at ones that returned before 7 months and ones that returned after 7 months, and they discovered that the ones that returned 7 months prior had an increased risk of injury, and that's no surprise to us as athletic trainers, but what's important is there's data to back that up and to prove that with care and with engagement from an athletic trainer, we're going to be able to reduce the onset of re-injury after surgical repair. So with that, data-assisted decision-making, and that's what we're looking for. We're looking for data-assisted decision-making, and that goes back into the quality improvement of population health. So looking at the quality improvement in healthcare. So what we want to do is we want to look at the different stages of this and how the data-led population health is essentially developing a new approach for us as healthcare professionals. So first off, without data, there's no population health, right? And the health outcomes for a group, we're looking at athletes generally, the young and healthy, and, athletic trainers design the best outcomes for the young and healthy, but what can we do for individuals that are aging and relatively healthy, right? So what we can look at is the occupational setting, public safety, and YMCAs as athletic trainers are in those settings as well. But what are they doing to provide on-site care for different individuals to help reduce their onset of any type of discomfort and improve the health of populations? So looking at the patient experience, right? So we can learn a lot from history, as it turns out. So first off, we look at two examples of individuals from the 19th century. Florence Nightingale, who looked at and basically developed the modern day nursing. And what she did was, as a statistician by trade, she was in India with the British Army, and she observed that many individuals in the camp were dying, and she linked this to bad drainage, contaminated water, overcrowding, and poor ventilation were causing such a high death rate. So with looking at the information that she was collecting, she concluded that the health of the Army and the people of India had to go hand in hand, right? And what she did was she utilized the data she was working with to improve sanitary conditions in the country, or specifically the camp that she was in. So again, improving populations of health at this time is extremely important. Looking at Ignaz Semmelweis, so a Hungarian physician, and what he looked at was why so many mothers and children were dying as a result of infection after birth. So the hospital that he was overseeing as medical director, he noticed that doctors, after performing autopsies or education where they were cutting open dead bodies, they were not washing their hands and going straight from not washing their hands to delivering children. And obviously, we can look at that now as a no-brainer, but at the time, there was no link to it. So utilizing the data that he was collecting, he was able to improve the patient experience and reduce the onset of childhood death and disease at this time. So that's looking at history. That's how we can improve patient care. So moving forward to the quality improvements and what we can do to bring this all together. So again, we're looking at, it's broken up into three categories: the structure, process, and outcomes. So the structure is going to describe the context of care. The process represents the transaction between the patients and the providers, right? And then the outcomes are usually the results that we're gathering. So what we need to focus on is the individual. How are we as a profession providing to our patients? So we need to first identify what quality improvements that can be developed based off that structure of care, then going through with that process and developing outcomes as an end result. So with that, we'll go into a case study that I have been working with that brings us all into brings us around to the finish line. So with that, a large hospital system with over 70 athletic trainers, and what they're doing is they're utilizing the best practices of athletic training. So what they're doing is they're focusing on what are some good evidence-based practices that are out there right now. So they're looking at with any type of hydration and cooling systems. I had the opportunity to go out on site to observe a meet that they had, and with that they had a bunch of different athletes that were experiencing, not to say heat illness, but they were overheating. They had cooling stations and misting tents, so they're utilizing the best practices in that. They're utilizing the best practices in documentation and what we can do to improve the patient outcomes. So with that, looking at what type of information that we're producing, for one, the data that we're collecting, and how to utilize the evidence-based practices out there are going to be important for assisting us to become better healthcare providers. So moving on to the value. So looking at the cost perspective, and Lee had a really good study that looked at how athletic trainers were saving costs and money in the Oregon school system. So what they discovered was athletic trainers saved about $64 per patient. And a lot of this was attributed to the on-site athletic training services may reduce emergency visits for these individuals that have commercially insured patients. So what this looks at is it looks at a community cost savings. Also looks at the hospital referral revenue, and there are organizations out there that are looking at this hospital referral revenue. But with this, we have a tremendous opportunity as athletic trainers to reduce the cost out there, right? As talking with Dr. Lee, had a great discussion with him, and as a healthcare economist, he linked athletic trainers as the #1 medical profession that helps saves community money. So that's tremendous out there, as it could potentially help develop a new direction in the amount of not only care, but services that we provide for communities. So let's look at the gap and bridging this gap and bringing this all together. So we'll discuss this in depth, but looking at data's role in bridging the gap. So ways that healthcare is tying triple aim together. So we look at diagnostics. So what type of data are we looking at through our notes? We're looking at preventative medicine. So what we want to see is a predictive analysis and data analysis of genetic, lifestyle, and circumstances to prevent disease. So with that, athletic trainers are really good at preventative medicine. I'll talk a little bit about that. So precision medicine is leveraging data to develop personalized care. And then this goes into the population health aspect of we monitor the data, the identified disease trends, and then strategies to develop for our patient group. But first, let's focus on the diagnostics of data's role in bringing this all together. So having a good, effective EMR is extremely important. So we need an EMR where we have the ability to run reports, identify trends, and look at what's going on with any clinical suspicions, right? So what are we seeing? Are we seeing any anomalies out there? Are we seeing anything that's different that might be taken into our role as healthcare professionals? What are trends? Are we seeing more ankle sprains with a cross-country team, right? Or are we seeing an increase in knee injuries? So what can we do with that information? Well, with that, we can develop forms of preventative medicine. So we have the most potential above any other healthcare setting. So with that, we're able to see patients, while they're healthy, we discussed before. We can monitor changes over time and utilize effective baselines. So looking at the diagnostic, running reports from one year to another, where are we developing any type of injury prevention programs to reduce the onset of ankle sprains with a cross-country team? Are we comparing that information, just like we saw in the study with the muscle strains? So with this, there are many opportunities. But taking it a step further, we look at precision medicine. And some examples out there are the United States Olympic Committee. So some of the data that came from there, they looked at wrestlers on the women's team, and they assessed any type of ACL injuries, or shoulder instability, dislocations. And with developing a specific program for those individuals, so specific strength program, we're able to they were able to reduce injuries that required surgery by 60%. So that's what precision medicine comes into play. So developing, based off of the data that we're collecting, a precise program for an individual that's going to be beneficial for them as a competitor, to reduce injury and to falls into play with the population health aspect as well. So we have all this information. How are we going to collect it, and how are we going to present this data? Right? So there are many ways that we can do this. With that, we have observations, and we do this all the time. We have surveys and questionnaires that we can produce, and then the data tracking and documentation that comes into play. The pre-participation clearances, we're also collecting information from that, and then the concussion testing. Breaking it down and looking at our observations, so this is simple. It's firsthand information. It's straightforward and efficient. So we do it all the time when we're assessing an injury. Generally, we're right there and we see exactly what happened. But we ask those questions too when we are doing that assessment. So how did it happen? Of describing discomfort, where does it hurt? Again, that's not only going to be the observation of the clinician, but also with the patient as well. Really, at the end of the seasons, developing any type of surveys and questionnaires and experience with that, you can get a lot of information through the on-site staff that you work with and from patients, parents. Developing any type of surveys and questionnaires is going to be important for outcomes data as well. Discussed that before, but with that, this is popular to collect data, and it's inexpensive, and it provides a broad perspective. So generally, we want information that's sought in large numbers. Not all the time we can do that, but it does measure changes in time as well. So what type of services that we're providing on site is a good place to start, and a good example is the global rate of change breaks down discomfort and how athletic trainers are what they're providing and the amount of improvement that's done. So global rate change is out there, and it's a good and a valid and reliable healthcare outcomes measure. So, and usually health questionnaires are popular to present as well. Looking at our daily tracking and documentation, we talked about this extensively, but just, how are we going to track this information? Ideally, I don't like to do everything on paper. When I say paper, we're not writing our notes on paper, but it's the injury note, but it's more or less taking notes. So I personally carry a notebook around and jot down notes of encounters that I've had with individuals, and at the end of the day, I'll put in the information that I've tracked with that individual. So it just makes it a little bit easier, just because we're not around a computer all the time, a little bit more efficient with just note-taking in general. But when we're taking an injury note on paper, again, it's not a fan, and really it's not the right direction to go. But when we're doing daily tracking, some athletic trainers are doing Google Forms, which is great. We can link that to what we're doing with the amount of people that are coming through, and essentially you hand a tablet to someone that's coming in, they write down their information or type in their information. But with technology, it's not always available. The goal here is to collect the basics, but emphasize the specifics. So key findings that we have with individuals. So looking at pre-participation clearances and concussion baseline testing, really there's a lack of inconsistency with organizations across the spectrum when we look at pre-participation clearances. So PPE should include the following data points to collect, but not all the time is that information available. So in order to have a good, effective PPE, we need these data points to collect. And, getting better at it, but, we need to have more consistency across the board. Along with concussion baselines, too, a lot of organizations are utilizing the software to help with that baseline testing. You talked about that as a functional assessment to compare when someone is healed versus someone injured and making sure that they're getting back to those specific points. Right? So when we look at all of this, we want to say, how can we present this information? How can we present this to stakeholders? And his experience with me is producing quarterly reports and then summarizing those findings. So with my clients, I'm always providing a quarterly report to make sure that they have that communication with the services that I'm providing on site and what I'm doing. With that, I'm making that report sleek and attractive for individuals to look through, but basically having that first page of the summary, the big numbers. How many individuals are we seeing? What are we seeing the most of? Are we having an increase or decrease? But we want to highlight those achievements there and then be able to answer questions with those reports so we can lead our stakeholders into the right direction. So as an example, with one of the case study or an example of that is a client that we've had in the past was not interested in any reports, but the more we started to give those reports, the more that they wanted those reports. And when we're looking at this now, they're asking for those reports ahead of schedule. Obviously when the data is in, but that's when it comes down to this is valuable information for those individuals, and it justifies their value. With producing these reports, we're able to expand outreach services to different areas with that. So reports can be vital information for our stakeholders and can provide us with more opportunities. So lastly, moving on to the final part is how do we become that data-driven athletic trainer, right? So some ideas to branch off on is experimenting and taking that initiative. We need to change the disposition, and that really all goes into being more innovative with our approach. And we need to learn more as we go through this process of becoming that data-driven athletic trainer. But this does improve our ideas and what we develop as professionals. So experiment. We want to, with that, observe trends within our facility, and we want to take a closer look at the data. So experiment and implement new practices based off of your data. I've discussed it before, but we could do a comparative analysis. Are we looking at an increase of X, Y, and Z? What can we do to reduce X, Y, and Z? And how can we become a valuable asset within our organization? One thing with that is when we perform experimenting or we utilize data to our advantage, we're able to take more initiative in our approach as healthcare professionals. So really that's the next step in after the experimental stage is taking that initiative. So we experiment, we see what's going on. So with that is we inform those within our institutions, we make improvements one step at a time, and we want to take advantage of that preventative aspect. So if anything that I can recommend as something to try is some of these preventative the preventative steps into reducing any type of injuries, looking at that data and seeing where our injuries are. But in order to collect this, we need somewhere to put this information, and Excel is a great place to start because there's a lot that we can do with Excel, and most computers already have this installed, and it helps us organize our information more efficiently. So there are plenty of resources out there that will help improve your Excel knowledge. One example is edx.org. There are free Excel learning centers on there that are presented by Microsoft data scientists that are very simple and easy to understand and will help improve your knowledge with Excel. But the more information that we collect, the more opportunities that we're going to have, as discussed. So with that, moving on and discussed it before, but improve the documentation practices. One thing to be a data-driven athletic trainer is to increase the documentation practices. And daily tracking is going to be key, right? Like I said, developing prevention programs based off of documentation. So with that, we can develop ideas that can help our position as professionals. So with my experience, data collection has assisted me in development of new ideas within the organization that I'm associated with. Able to collect that information, to present it, gain more confidence, provide stakeholders the understanding that there's initiative within this program, which creates a successful program, but able to get ideas based off of the information that we're collecting is going to be important, again, to provide more opportunities. But in closing, let's ask what's clear within our organization? What can we do better? What can we do to improve the quality outcomes, improvements? There are going to be opportunities that lie in population health. And from there, we have to develop that information and be able to present it to stakeholders. But overall, data will continue to be important within our profession as we are a data-rich profession. We have data all around us, and we are obtaining information all the time. But just organizing it in a way is going to be important for us. So we need to utilize what's available to us. Focus on the tangibles, right? That's going to be important. But I would like to thank you for listening in, and I hope that your endeavors in data collection will be fulfilling and fruitful, and I hope you have a great rest of your day. Thank you.